Hi everyone, Dr. Nemechek here. Time for another weekend review. Just a quick reminder, hit subscribe so you can stay abreast of all of our upcoming postings. So first case I want to chat about is a 11-year-old girl. She had started the protocol back in 2017. This is before they had come and seen me. Rather kind of intense, like nonverbal, a lot of developmental delay, tantrums, basically wanted to play alone in the dark and just had zero interactions with the family. The parents said they were no more interesting to her than a piece of furniture. Okay, so she had just intense level of kind of intoxication from that propionic acid or sedation. And they started on the basics, fish oil, olive oil, inulin, dramatic improvement. She basically has an awakening, good eye contact. She started interacting with the family. Tantrums are coming down, starting to learn to follow and, respond to commands like that. And then, so that was going on for, as you can see here, about 5 years. And they come and see me in August of 2022. And she'd been doing better, but they were seeing her hyperactivity was getting worse, her tantrums were getting worse, she's starting to injure herself. And so we switched at that time from inulin to the monthly rifaximin, and big improvement. So monthly, the cyclic rifaximin is 10 days, twice a day rifaximin for 10 days, 20 days off. So on the 10 days, she'd be doing better, but as in that 20-day gap, she started to deteriorate, and what's happening is the bacteria is just relapsing again, okay? So basically in the next visit, we shift her from the cyclic or monthly to continuous, so that's now twice a day, nonstop. Self-injurious behavior, tantrums, hyperactivity are going down, speech is improving, socializing is improving. Was having some bad constipation. We added the PHGG. This is the partially hydrogenated gargum. Constipation gets better. And then, as time evolves, it wasn't until the spring of 2023 we had the first inkling about glutamine being able to help with COVID gut damage. And we added that. She's actually had 2 courses, and each time, big improvement of hyperactivity and aggression. Those got better. And so, now, all through 2025, up and down negative behaviors, worse, better, and she is just suddenly starting to shed her teeth. Okay, so she's had her baby teeth, her milk teeth, till she's 11, and as those start getting loose and coming out, it drops the blood pressure, and you get more and more aggressive behavior. The teeth come out, blood pressure improves, negative behaviors go away. And so when I saw her this week, and so she's been on the protocol for a total of 5.5 years. She's on twice daily rifaximin, PHGG. The brand we use here, we recommend is Nutrisource by Nestle's fish oil, olive oil, vagal stimulator. Basically doing great. Language continues to improve. And the newest most thing is in kind of intellectually and a maturity level, she's starting to talk and reflect about things in the past, okay, which is really now being able to think in more of an abstract way rather than I want to do this, I want to eat that kind of stuff, more immediate stuff. So she's doing really well. And just a normal, typical transition of what we have to do at times. Next, so I get to the next 2 are older patients. I've got a 71-year-old woman. She started 2 years ago, just lightheadedness, anxious, abdominal, kind of pelvic pain. She's got high blood pressure, and she's on 2 medicines. So we put her on the adult regimen, rifaximin, fish oil, olive oil, and 2 hours of VNS a day. And within 2 months, dramatic improvement of abdominal pain, lightheadedness is getting better, anxiety is getting better. We've tapered her off one of the blood pressure medicines already. And then a really bad year in 2024. She had some death in the family, the family house burned down, things of that sort. And with each of those emotional traumas, I've talked about how they can injure you like a physical concussion, actually. And the anxiety, abdominal pain, constipation would all relapse with these, and then she would start getting better, and then she would relapse again, get better. And finally, though, just luck was with her. These bad events quit happening. We're able to get her off all of her blood pressure medicine now. Finally got off that second one. Gave her a course of glutamine. As you can see here, big jump in energy, less abdominal pain, less constipation. So this glutamine for this COVID, I just got to say, it gives most, I would say, 75% of the patients a big bump when they get that stuff. So this COVID gut problem, I think, is a very substantial or frequent thing. Anyhow, doing good. Kind of in the summer, fall 2025. We're seeing this relapse. Anxiety's coming back. Constipation's coming back. She's still on rifaximin and everything. And she has a Baker's cyst. That's a cyst behind the knee. And that starts, she had it originally after an acute injury years ago, and it went away. All cysts in the body are from inflammation, okay? And when you see cysts growing, that means you've got more inflammation. And so I'm thinking, she's on rifaximin, fish oil, olive oil, vagal stimulator, but she's developing inflammation. The only thing it can be is COVID. And when I talked to her, she said she wasn't sick. She had been around some people kind of the end of June with COVID, but she also told me the prior 2 times she had COVID, she tested positive for it. She hadn't any symptoms. So I think she just developed COVID again in the summer. So we're going to hit her with another course of twice a day glutamine for 6 weeks, and that ought to fix that inflammatory part with COVID. Last patient is a new patient, but some interesting thing here again about COVID. 65-year-old male, 2 years ago, rapid heart rhythm, atrial fibrillation in and out. So he had a fast normal rhythm, and then he has this fast atrial fibrillation, which is an abnormal rhythm, and then these low blood pressure episodes where his pressure will just crash. So that was kind of the main symptoms, but also interestingly, night sweats, going to the bathroom more frequently in the daytime, and achy all over the place. All of this starts about a year after COVID, and I couldn't get it might have been just 6 months after COVID. Now, what's happening in COVID is you can track COVID, you get over it. But in 25% of the people, they're showing now they're developing these holes in the small intestinal tract that cause chronic inflammation, and that inflammation, so you can have COVID, you get over your symptoms, you feel fine, but in 2 or 3 months, you start having symptoms, and they tend to be neurological symptoms first. And that's part of long COVID that's happening from this leaky gut inflammatory process. And so I think that's what triggered all of this in him, because something has to happen for this to happen. And then they've also shown after you've had this long COVID for about 6 months, you can start to develop SIBO on top of that. And I think that's where SIBO is a common cause of night sweats, increased stool production. He also had some food intolerance, and then just this diffuse joint pain all over the place. And so he took this supplement, and I don't think he fully understood, but it contained arginine with a bunch of other stuff. Dramatic improvement in his heart rhythm. There is a lot of evidence. I mean, basically what happens in long COVID, instead of leaky gut in the intestinal tract, they also have leaky blood vessels, okay? And they don't work right, and that was affecting his cardiac conduction system. And they've shown in these papers dramatic improvements with arginine, all right? And then the other clue he gave me, and not really for him, is he got this steroid shot for his back, and then he realized it made all these other aches and pains he had go away. And so like his knees and his hip, he was told, you got to have surgery on those things. And he's like, well, why would all those get better if I need to have surgery? It's not a surgical problem, okay? And so he's kind of putting all that together. Now, so what we're doing is, I think he's got SIBO from the night sweats, so we're going to put him on rifaximin, fish oil, olive oil, VNS, and I pretty much routinely use continuous rifaximin on the adults now for the first 4 months, and then we see how well things are. And then we're going to give him the glutamine. Now, in terms of arginine deficiency occurs primarily when you don't have enough glutamine. Okay? I told him to keep taking the arginine for now. I think the glutamine is going to heal up his leaky gut, and that extra glutamine is going to normalize his arginine levels, and so he won't need to continue that for the long term. So, very interesting case. I'll try to make a point of bringing this one back up when he comes back in a few months. That's all for today. Everybody, have a good holiday season coming up. And just remember, take care of your kids, take care of yourself, keep your inflammation down. Till next time, this is Dr. Nemechek. Thank you.